For young women, the recommendations for primary prevention of cervical cancer include vaccines. There are a few HPV vaccines that are available. With regards to when we give them, it's now routinely recommended for 11 and 12-year-olds to get it, but they could get it starting as young as age 9. And then there's this catch-up population up to age 26 that's been recommended by the U.S. Federal Advisory Committee on Immunization Practices. There are 2 available vaccines in the United States currently. One of them covers 2 different types of HPV. Another one covers the same 2 types in addition to 2 types that have been associated with genital warts and external genital lesions. With regards to how well these vaccines work, both are extremely good at preventing disease related to the 2 kind of bad HPV types that cause cervical disease. The efficacy for both of these vaccines are excellent for that. With regards to the coverage for genital warts, with the one that also has the other 2 types, what we call the quadrivalent vaccine, it's excellent at preventing genital warts and other external genital lesions. The quadrivalent vaccine has also been shown to actually prevent not only genital warts, but to also prevent anal disease as well, which is another precancerous disease that is associated with human papillomavirus, which is the cause of all of this disease. HPV is ubiquitous. Everyone's got it. Everyone's been exposed to it, but very few people that actually get HPV actually get some sort of disease. Disease is rare, even in patients that have had an HPV infection. Most HPV infections come and the immune system gets rid of them really well, okay? Some stick around, and when they stick around and they persist over long periods of time, those are the ones that are most apt to ultimately lead to disease, okay? So as part of the strategies for screening and prevention, takes all this natural history of HPV infection into account in order to allow for regular, adequate follow-up of patients and prevent, ultimately, cervical cancer, which is what our goal is. And by vaccinating early and getting Pap tests regularly, we can really prevent cervical cancer.